Good morning, everybody. Good morning. My name is Monica Fox, and I am the manager of outreach here for the National Kidney Foundation of Illinois, and I am delighted to see you all here. Look at how full this room is. Please give yourselves a round of applause. Thank you so much for traveling out here and coming to educate yourself about this important, to receive this important information. And thank you to all our vendors who are here. We couldn't do this without you. You bring in valuable information to our patients that we gather here. So we thank you all for your continued support. It is my honor and privilege to introduce you all to our new CEO, the new CEO of the National Kidney Foundation of Illinois. Effective April 1st, Jacqueline Bishop Burgess, we call her Jackie, became our new CEO. She is energetic and enthusiastic and committed to this cause, and we promise you, if you think we've been doing great things thus far, which we have, just stay tuned, because we're going to really take it to the next level for kidney disease, chronic kidney disease, and health and prevention and transplant. So, without further ado, I present to you Jackie Bishop Burgess. Bishop.
Well, good morning, everyone. It is truly my honor and privilege to be here. Monica's done a phenomenal welcome, but I'm going to welcome you again to this year's Living with Kidney Disease and Transplant event. I hope you've enjoyed the breakfast so far, and please feel free to continue eating as we go through the program. As Monica introduced, I'm Jackie Burgess Bishop, the new CEO for the National Kidney Foundation of Illinois. The mission of the National Kidney Foundation of Illinois is to improve the health and well-being of all people at risk for or affected by kidney disease throughout prevention, education, and empowerment. So we, again, impact this disease through prevention, education, and empowerment. As many of you know, today's event is one of our 5 signature educational programs held annually in both Chicago and Champaign in English and Spanish. In addition to our educational events, we also host other community-focused events like our Walk for Kidneys taking place on June 25th, where more than 4,000 people will gather to raise awareness about kidney disease and its precursors. Formerly called the Living with Transplantation, then Living with Kidney Disease, this event has been growing and evolving over the last few years to allow patients in all stages of the disease to network and learn from professionals, but also from each other. I was speaking with Eric at the table today, and we were talking about the importance of listening and what you learn by listening. So we're here to listen, to learn from you, to learn as you learn from each other, and share. The benefits of transplantation are many. As we've done in past years, I would like to take a moment to ask all patients who have received a transplant to please stand up. All right, so now we're going to see how your listening skills are. All right. Now, if you've had a transplant for 2 years or longer, stay standing. All right. 5 years or longer, stay standing. 10 years or longer, stay standing. This is a robust group. I'm impressed. All right. Okay, this is good. 15 years or longer. All right. So for those that are still standing, if you don't mind sharing in terms of The length of time, I'll start with
32 years.
Oh, 16, phenomenal. All right, that's fine. Thank you.
20 years.
20, thank you. 16, you're wonderful. Thank you, and thank you for sharing. So before anyone else, thank you for pointing out. Okay, thank you for your 14 years. We appreciate that. Thank you all. You're living examples and inspiration to us all. So for those of you who are considering the journey of transplantation, you may want to seek out these people at some point during the day to ask about their journey and benefits and the struggles that they have experienced. Additionally, if you'd like more information on the National Kidney Foundation of Illinois and many other programs and services that we offer, please visit us at some point during the day, either at the registration table or our information table, which is full of brochures and information. You can also visit our website at nkfi.org. For your convenience, we will be recording the event and uploading the videos to our website so you can go back and watch all the speakers you did not have an opportunity to see. We will also be posting all PowerPoint presentations online early next week. Now, I'd like to take an opportunity to recognize our sponsors and exhibitors that are here with us today and have helped us to put this program together. Many of these sponsors have been supporting this program since day one, and their generous support is truly invaluable. Please be sure to stop at their tables, each table at some point today, very important. They have essential resources and information to share with you. So as a formal thank you to our sponsors, we'd like to recognize Advocate Healthcare Transplant, Gift of Hope, Illinois Transplant Fund, Loyola University Transplant, Meridian Health, Northwestern Comprehensive Transplant Center, Otsuka Pharmaceutical, Rush University Medical Transplant Center, TGB Medela LLC, Cairo One Wellness, UI Health Transplant, UW Health Transplant. And we cannot forget about our dedicated committee members. Your dedication to this cause is the reason we are able to put on this event. Thank you, Ning Ramos, John Valencia. If you're in the room, please just raise your hands as I call your name. Doug Penrod, Judith Pasaki Anderson. Forgive me if I butcher a name. I'll get it right next time because I'm going to introduce myself and you'll be able to tell me. All right. Melissa Bester, Melissa Prest, Dave Dreyfus. Your support is immensely appreciated. So can we applaud for our sponsors and our committee? Oh, I can't applaud. A few things as right before we begin. At the beginning of the program, please turn in your feedback surveys and you'll receive an NKFI freebie. Very simple. Before we begin our patient panel, we'd like to remind you we will be raffling 2 gift baskets at $1 per raffle ticket. Please consider purchasing tickets from our wonderful volunteers situated just next to the registration down the hall by the entrance. So before I bring Monica back up, I would like to share my story from my perspective. And one thing I had an opportunity to say is every story is unique, every story is meaningful. The story of every individual in this room is meaningful. So I entitled my story, The Grandmother That I Never Got to Know. My maternal grandmother died from kidney disease when my mother was 14 years old. So in addition to my mom going through her adolescence and adulthood, without her mother, I never got to know my grandmother. And so I'm here for the cause, as Monica mentioned, to make a difference, to educate, to support the education, to support the raising of funds, to support the advocacy, to support the mission through prevention, education, and empowerment. It's meaningful to me. So that is my kidney story that I wanted to share. And I look forward to hearing the kidney story from many of each of you for your stories. So with that, I'd like to welcome our patient panel participants. And Monica, if you could come back to the stage. She is our manager of community outreach, and as you may know or will come to know, a great asset to our organization, as are all of our staff, phenomenal team. And I wanted to take the opportunity to recognize them at this point. So we could clap for, I started on Monday, so Monday was my first day. And so if we can just recognize the staff, I can't clap, I appreciate it, thank you. So Monica herself is a transplant recipient, has a great deal of knowledge, and she will be moderating the panel, the patient panel discussion. Thank you.
All right. I'm going to introduce the panel members. And that was a cute little clap that you guys just gave, but I'm going to need you to do that better when I introduce these next people, because they are amazing, and I'm just so happy that they are here. So first, I'd like to introduce you to David Poteet, or Poteet. Yes, David is a kidney donor. Thank you, David. And next, I'd like to introduce you to Kelly Roberts. She is David's kidney recipient. Wait till you hear their story. Then I'd like to introduce you to Ghani Williams. He is waiting for transplant and is not on dialysis. He is listed at Advocate. Next, I'd like to introduce you to Miss Betty Harper. She is a 14-year transplant recipient. And I'm so glad you get to hear from her, because the day I met her, she really encouraged me, and I think everybody should be encouraged by her. So I'm going to ask each of them, I'm going to give them the microphone, and ask them each to take about 5 minutes to share their story, and then we'll have some time for questions and answers. So everybody listen closely and let us know, be ready to let us know if you have questions in the end. I'm going to start with David. You want Kelly to go? Okay, Kelly's going to go first. And then David.
Well, okay. Hi, everyone. I'm Kelly. I'm fine. I was born with chronic kidney disease, and unfortunately, it is hereditary because my daughter has it as well. I am very thankful to Loyola Hospital because they have watched me, actually, for a very long time. They even watched me when I was pregnant with my daughter. And I'm just so thankful to them. When I found out about my kidney disease and how bad it was, my GFR was at a 15. At that point, I was working at, I worked at Lexington Retirement Home. I worked with Alzheimer's and dementia patients. So I'm running around up and down halls taking care of them. I got really sick one day and I passed out at work. Went to Loyola, found out what was wrong, and everything went so fast at that point. I didn't know how to take everything all in one day. I think I sat in Loyola's parking lot for 2 hours until my mom came there. Sorry. because I was trying to figure out, how do I tell my 8-year-old? After that, I was trying to figure out what I need to do. I followed the transplant team, did and respected everything that they asked of me. I struggled a lot, and I figured out, how am I going to spread the word on how I need help for a kidney transplant. Once I got on the list and accepted, I just kept praying, and what do? I can't just go up to somebody and say, hey, got a kidney? I need one. You know, so I talked to kidneybuzz.com, actually, and I ordered my bracelets to make sure I wore on my arm for when I did have my dialysis surgery for the fistula of my arm. And they educated me a lot. And also the transplant team at Loyola, I took all their information and I figured out, how am I going to do this? Okay. I started a Facebook page. I started just pouring my heart and soul about how I was feeling every day. How am I going to work through this? And how is this going to help me? And at that point, I was just posting live videos, how I was feeling. Oh, today I had this treatment. You know, this went wrong today. I was just laying it all out there. I even had a lot of people step up that wanted to be tested because I shared my story. It was at the point where, after I had 2 surgeries on my arm, until they finally got my vein and artery to work, and my parents received a phone call. Granted, they didn't tell me. I didn't know. Unfortunately, Loyola had to deal with a lot of people calling them because I kept on giving their number out, like it's a 1-800 number. But my pastor, who I've known since I was 13 because I went to school with his daughters, and his youngest daughter actually married my brother. So now we're really family and sharing organs. So at that point, I was like, why are they delaying me on dialysis? At that point, my GFR was at a 6. I was like, I'm so tired, I can't even get out of bed. I can't even function as a mom to my daughter. The following week, I overheard my parents talking. I was visiting them. And I overheard them mention about my pastor wanting to be and being tested for my donor. I would say after I found that out, I called him and I told him, I think my mom called you because they didn't want to lie to you that I knew. And I was just in shock because every time you hear somebody that wants to be tested for you, it's like you don't want to know if they are a match or not, because I've been let down before. And that's harder. I would rather not know. I would rather just say, we're not a match. And I've talked to so many people who've had living donors being tested. At this point, my mom and dad are all excited. And I was like, well, don't forget about the last times. Don't get too excited, just pray. I get a phone call about 2 weeks later. It's FaceTime with my pastor and his beautiful wife. And I found out that he was my perfect match. From that point on, yes. From that point on, I was so excited and so nervous at the same time because I'm trying to balance my home life with my daughter and stay positive, but at the same time I'm scared. And I'm like, you know what? It's all in God's hands. It will just be what it will be. Loyola took such good care of us. And I'm so thankful to this day that I can get to continue being a mom to my daughter. And I still spread the word on my page. I have never taken down my kidney page because my journey is not over. I'm going to continue on bringing awareness because, yes, I got a kidney transplant, but there's so many other people. Even donating blood is such a big help. And at this point in my life, I am just so blessed and thankful. And I don't know, words can't even describe. And I will not give up on other people. Everybody is always in my prayers. And don't give up. Just stay strong and keep sharing whatever you need to. And I will pass it on.
Kelly is like a third daughter to us, to my wife and I. Our two oldest daughters are about the same age. When we met Kelly and our daughters started going to school together, it wasn't too long after that I was aware that Kelly had a kidney problem. It just didn't really click. And I knew that she was on the transplant list, and it still didn't click. But then when I heard that she was getting ready to go on dialysis, and her prognosis with dialysis was still only going to be about 3 years. It just wasn't looking good. And it clicked. I've been a blood donor since I was 18. I've always registered to be a donor upon my death. I even told them when I went in for the surgery, if you see anything else you need while you're in there, take it. And I appreciate your applause for me, but I, as a pastor, I say this respectfully because, I sort of like God. But donating was perhaps the most godlike thing that I have ever done. And that, well, and when I go back to Loyola for follow-up testing or at a candlelight visual tomorrow, from 12 to 2 in the gym, if you're free. It's like walking on holy ground. And as a living donor, I want to get other people to seriously consider it. I am torn between why didn't I do this years ago as an altruistic donor? I'm torn between that and yet knowing that because I did not donate earlier, I was able to be there for Kelly. But see, you can't live on the what ifs. When I realized Kelly was going on dialysis and she only had about 3 years if she didn't get a match, and a lot of people don't. You guys know this. Somebody's got to do something. Well, why not me? And the only hesitation I had that day was asking myself, well, what if my natural daughters need a kidney? I'd probably be a match for them. But the odds are they never will. And you can't live on the what ifs, you live on the what is. And what is, Kelly needed a kidney and I had one. And I know she had been let down before by other people who were either going to be tested or were tested and backed out. So that's why I kept it a secret from her. I mean, I was 59 at the time. That's not young. Granted, I look great. I'm just kidding. I lost my train of thought. I'm so sorry. This happens in my sermons too. So, thank you. You live on the what is. And within a couple of hours that day, I had already decided, and then I talked to my wife, and I don't know if Veronica from Loyola remembers, but I pushed. I was calling them. What's the next test? What do we do next? This needs to happen fast. Come on, people. And it seems, I think it was a fairly short time. It was the last week in May, and our transplant was July 13th. Because I was good to go. My mind was made up. There was no backing out. And my only fear was if I'm not a match, would she be disappointed? So anyway, we can talk about this stuff for hours. And any questions, we love it. I'll be here till probably the last person leaves today because I just love advocating for this stuff. But if I had it to do over again, there would absolutely be zero hesitation. Zero hesitation. Profound life experience that I am humbled to have been a donor. And we who talk about it, it's not about, hey, look at us. It's that we got to be something, part of something that is so unbelievably precious. When I walked into her room after our surgeries, And she got up out of that chair with all those wires and cables and everything hooked up to her. And she gave me a hug and whispered in my ear, "Thank you for giving me life." That is profound. Not many people get to be a part of something like that. So some of you in this room, you may need to consider being a living donor. And for those of you who need transplants, put it out there. Kelly did, and it worked. And don't be afraid to tell people, hey, I've got so many years left, because that's what clicked for me. Okay? I need to stop.
Thank you so much for sharing your story. We call this section Share Your Story. It's so important for everybody to share their story. If you don't learn anything today, is that it's important to share your story, whether you're waiting, whether you've received, whether you've given. Share your story, please. It's important. We have to raise awareness about this issue. So next, we'll hear from Ghani.
Hello, my name is Ghani Williams. My story is not as dramatic as those stories. Pretty much my story is I was getting these terrible headaches, and unfortunately I didn't want to go to the doctor. So during that time I was actually still married, and it was my ex-wife that actually forced me to go to the doctor. And at that point, found out I had high blood pressure. But it seems like the high blood pressure was so prolonged that it caused some damage to my kidneys. So that's when my journey began with seeing a kidney specialist. And if anything I can tell anyone is to maybe go to the doctor. You know, especially for guys, you know, sometimes we're a little bit more hard to convince to go. But I think if I had anything to change in my story, if I would have listened to my wife a little sooner, I think maybe, you know, unfortunately, this wouldn't have come to pass. But it is where I am. And the fortunate thing is, actually going to the doctor on a regular basis, I felt fine otherwise. I never really had any other pains outside the headaches with the high blood pressure. Now I'm with medication, but I've been waiting for maybe 7 years now. So everything is pretty much stable for me. But one thing I really learned is that there are professionals out here, and you want to take advantage of them. And for males in particularly, you really need to go to the doctor. So, you know, that's my story. So.
Good evening to you all. I am Sister Betty Harper, and I am a kidney transplant for 14 years. I have to greet you in the name of our Lord and Savior, Jesus Christ. My journey began, I was born with one kidney, but nobody found it out until 3 babies. I had 3 babies, and I have to give Dr. Alter from on 26th in California, 26th in King Drive, when it started out. He was with me for some 10 or 12 years to help save my kidney. So I decided, I was working for the Postal Service, And I said, well, if I retire, you know, everything's going to be okay. I always suffered from low blood pressure, but then they said it had elevated to high blood pressure. But anyway, my journey ends in 2002 when I went on dialysis at Michael Reese Hospital. And I had told him I ain't going on no dialysis. I'm not going on no dialysis, but when my creatinine got up to like 10, I have a doctor in my family, and she says, well, Auntie, people with 10 and 12 creatinine, they're on dialysis. I'm not going on no dialysis. But I ended up going on dialysis in 2002 at Michael Reese. And I stayed on dialysis for 14 months. And then they had to they had to put my shunt in my chest because I had decided I wasn't going on dialysis. But they did emergency, and they put it in my chest. Well, I stayed on dialysis for like, I think 14, 15 months. And they say, well, we're going to have to put it in your arm. I say, help yourself. They put it in my arm, but it didn't work. So they said, well, we're going to have to go on the other arm. I said, no, you're not. So he said, well, the only other thing that you have, you got to go on peritoneal. I said, come on with it. So I did the surgery and everything. You have to take, they have to teach you how. At that time, they brought a thing this high in my house for peritoneal dialysis. And if you all have ever been to any of the other transplant things, I think you can carry it around on your shoulder now. But I went into training for the peritoneal and got the surgery and all. It comes in your stomach, if you all don't know. And it's done by a computer. And you have to wash your hands. You have to be trained to deal with this because there's a hole in your stomach. After I took my 6 weeks training, and on my way home, rush, I had registered, well, I kind of got ahead of myself. My daughter was going to give me a kidney. And they, we matched, they took the thing, we matched 6 markers. So they said, oh, yeah, you good. But she needed to lose 50 pounds. She could lose 40, but she couldn't lose the 50. So I told her, I ain't gonna deal with you. I'm going on the kidney transplant thing. I got on the transplant list. And I guess, I was on there probably about 7 months. When they called me, said, Miss Hopper, I was on my way home. I was on my last training for my peritoneal. And on my way home, they said, come, we got kidney for you. I was riding in the pace car. I told him, I said, look, you turn this thing around and you take me to Rush. He said, Miss Hopper, I got to call in so they did. And I got my kidney February the 5th, 2005. So I'd like to tell all of you, just like he said, go to the doctor. I never thought that I would be, I didn't know I didn't have but one kidney. I'd been functioning on one kidney most of my life, but I didn't know that, and nobody had never tested me for it. So since I've got my kidney, I never had a taste for pop. But God is able to do exceedingly abundantly above all that one could ask and think. And I never drank. So all of that was good for me. And so I'm telling you, you all going to have to cut out the pop, the red meat. I'm not saying you have to drop all of it, but they are messing with some of everything and putting some of everything in things that we eat. Be careful what you eat. Be careful what you drink. and trust your doctors. Dr. Jensen and Dr. Mattel were my doctors at Rush University Hospital. I got my kidney, and I haven't stopped since. My birthday is April the 27th. I'll be 80 years old. So I tell you all, I try not to miss any of these, what is this? I try not to miss any of them. Come, get the information, pass it on. I brought 2 new people with me today from my church. They might sign up to be donors. You can live with a transplant, but you have to change. God made the trees change. So whatever you're doing to get your kidney in this situation, you have to change what you eat. You have to change your lifestyle. So when you change your lifestyle, I mean, God is in the healing business because he's still walking. God can heal you, and you can help heal yourself. So I'm asking you all, don't stop coming here. Don't stop doing what the doctor says. And I still tell you, you can go to Rush University Hospital and there.
Thank you, thank you. Whew, well, I'm excited and encouraged. How about you all? Let's have another round of applause if you are encouraged by these very brave stories. Thank you all so much for sharing your stories. It really means a lot. Don't leave yet because we have a few minutes left. If anyone has any questions they'd like to ask, you can raise your hand. I'll come to you with the microphone, and we can answer a few questions. We have about 3 minutes. Larry has a question. Okay.
What specific nutritional modifications have you made in your lifestyle to promote life?
I don't eat red meat. I don't eat pork. I drink no pops, Cokes and Pepsis and stuff like that. I cut the salt down, and that's about it.
Given the tendency to love salt, is there some spice alternative that you found palatable?
Well, the way they did me at Michael Reese Hospital, they bought me spaghetti. And they said, eat. And I told them, y'all crazy. I'm not eating that. But when you got all of these hooked up to all of these things, and they bring it back and tell you to eat it, that's what I did. And that's how I trained myself. I don't use nothing. I don't put no salt in. I don't use no alternatives.
Mrs. Dash, there are lots and lots of ways to season your food, and that's a good topic that we can talk about at our next seminar. So stay tuned. We'll have a spice expert come in and talk with us. You have a question?
Hello, my name is Barbara Barnes. I've been on dialysis about 5 years, and I'd like to know if people on dialysis can donate blood.
No. No. You got to hold on to what you got. Yes, ma'am.
Even with my transplant, I cannot donate blood because it messes with your DNA once you get the kidney.
Just a moment.
Living donors can donate blood. Be a living donor.
All right.
The additional question that I have relates to the transplantation. Normally, when a transplant takes place, there's a risk of rejection. The question is it necessary to take injections of some chemical, or are there pills that you take to provide anti-rejection drugs?
So you definitely have to take anti-rejection medicine for the rest of your life once you receive a transplant. Each person is different. Some people respond to pills by mouth. Others have to have some infusions of certain medications. So the transplant team works closely with each individual to monitor their labs and to make sure that the medications are allowing their body to accept the organ and not reject it. So each person is different. Me personally, I take medicine by mouth twice a day. I take a total of 6 pills a day, 3 in the morning and 3 in the evening. So one myth is that you go to transplant and you have to take a lot of medications. Guess what? I take less than I took when I was on dialysis.
Yes. Also, when you have a transplant, you have a team. You have a nurse, and I still can call Rush if I need some information. You have a team. You can always call your whatever hospital you at. I assume it's at all of the hospitals, but I can call Rush because my team is still with me after 14 years.
That was a great question. Great question. Okay, so it seems like we have answered all the questions, and we've got some exciting breakout sessions that we're going to move to now. So please take a look at your agenda. Everybody has an agenda in their orange bag that they were given. Take a look at your agenda and see which session is interesting to you. They are all going to be informative. You can't go wrong, but I'm sure one will ring your bell. And you'll be satisfied, you'll be happy that you went to that. And then those that you miss will be available by video on our website. So enjoy your next session.